Thank you for joining us today, and I'm excited to share with you for the next few minutes about one of ACP's newest technologies of the OmniFlow breathing therapy biofeedback system. As you see pictured here, and as I'm going to walk us through during demonstration for the next few moments, this is our virtual reality breathing exercise program that consists of our airflow sensor and our touchscreen laptop. The airflow sensor is plugged in via USB port to the laptop so that as the patient's completing inspiration and expiration exercises, the data is collected and transmitted onto the software so that on the screen, the clinician and the patient can simultaneously view how the patient's completing an exercise, what the target level is, and if they're achieving that target level. The clinician's able to go in and, as you'll see in a few moments, manipulate these parameters to find the right therapeutic threshold for that patient, and also to provide engaging exercises, as you see pictured here, such as our Diamond Mine, to keep that patient participating and understanding if they are reaching their goals. This can be for deep inhalation, forced expiratory volume, and rhythmical breathing to combine both inhalation and exhalation. And at the end, as you see featured here, and as we'll talk about during our demo, the clinician and the patient will receive outcome data that can be helpful to review with the patient so that they know where they are in their plan of care and in their progress. In addition, that clinician is able to document these outcome measures to be maybe more objective than what we would have in our documentation without the use of biofeedback. Two things that really stand out that make the OmniFlow breathing therapy system different is the fact that it does have this biofeedback capability in conjunction with the fact that it's a virtual reality animation feedback. Also, the fact that we can use both inhalation and exhalation exercises, while many tools out there will only allow you to focus on one or the other. We know from decades of research that biofeedback is very helpful in motor learning, and that's no exception with breathing therapy. We see, especially in studies that use virtual reality biofeedback, that those patients participate at higher levels and in higher intensity in their therapy sessions, helping them to achieve their outcomes quicker.
I'm going to begin today with our demo showing the Diamond Mine, or our deep inhalation exercise. This is used to improve inspiratory muscle power and inspiratory vital capacity. We're going to instruct the patient to breathe in slow and steady. As the patient attempts to breathe in a preset air volume in one breath, the inhalation is displayed as a vacuum cleaner collecting jewels and coins. A large diamond is collected for reaching the very far end target. This deep inhalation may facilitate improved diaphragmatic breathing, improved lung elasticity and volume, leading to increased muscle endurance required for proper function, self-care, respiratory swallowing coordination, and sustained speech production of words and phrases. As you see here, we have preset levels of easy, moderate, and hard, or we can customize. The challenge levels increase with the volume, how much air is expected, in this case, to be inhaled. We have the same option though for our exhalation exercises. Additionally, how many repetitions and how many sets of repetitions increases the challenge. Not shown today is a pre-exercise warm-up the patient can complete to get these specific target values. They range from 1 to 25. We can also go in and customize for any of our exercises or edit parameters to go through and adjust some of these parameters such as volume, flow, number of sets, number of repetitions, and rest period between repetitions. For our purposes today, I'm going to select easy. So we do get feedback automatically for our percentage. And this is an example of getting all of the coins and jewels in one breath. We'll do that again. Now, if I were to not have enough volume or were to not have a good lip seal over the mouthpiece, it may look more like this. Right, it kind of times out and it shows that we just got right over 50% of accuracy that time. That percentage is great for our patients to see, but we also get more objective outcome data here that our clinicians can use for their documentation. So we can see the best inspiratory volume level, also the average inspiratory volume level. We also can see this per breath or per repetition for the volume and flow levels. And then our loops, our flow volume loops, where across the x-axis we have our volume and across the y-axis we have our flow. And we can see with breath 1 and 2, where I completed this very timely in one breath with a good amount of air, that it stretches pretty far across the x-axis, it goes pretty deep on the y-axis, versus breath 3, where we have that deep, but we don't have the full air here. We don't have the full volume, and so it does not stretch across the x-axis very far. This is something that the clinician can use as a teaching point for the patient. Now I'm going to show you our prehistoric contest for forced expiration, and this is to improve expiratory muscle power. We would instruct the patient to take a deep breath and exhale as hard and as fast as you can. As the patient attempts to breathe out a preset air volume, again in one breath, the exhalation is displayed as a prehistoric javelin being thrown. The more forceful the exhalation, the farther the javelin travels, and the larger the size of the prehistoric animal that's rewarded as a prize. If the preset target value is exceeded, a mammoth is the reward. This forced expiration exercise can help with airway protection during swallowing, coughing, clearing the airway, and execution of adequate vocal intensity and phonation. We see again here that we have an easy, moderate, and hard preset level, or we can customize. This exercise is essentially an FEV1, or forced expiratory volume over 1 second. We'll go to our moderate level this time. Okay, so an example of getting to the farthest target and getting the woolly mammoth. We'll try that again. Okay, so this time I'll provide an example of not giving enough exhalation volume. Okay, so similarly to our diamond mine, we get the best expiratory flow and average expiratory flow here for the clinician to document and to show to the patient. Also the outcomes per repetition and our loops. So we can see the first couple of breaths had these nice, big, full loops, and that's what we would want our patient to shoot for. I'm going to take us to Starry Road now. For this particular exercise, it is very unique in the fact that it combines both inhalation and exhalation for our rhythmical breathing. As the patient breathes in, the figurine in the picture is going to move up this Starry Road path, and as they breathe out, she's going to move down. Again, we have these preset levels of easy, moderate, and hard, but additional to being able to change the target volume level, we also can change the duration, the timing for the inhalation and exhalation. That is going to make a difference for our path slope. So how steep the slope is going to be determined upon this duration. The steeper the slope, the easier, because less time that's required for inhalation and exhalation. And the more gentle the slope, the harder. And we can customize to change maybe just inhalation or just exhalation. Again, this can be great for expelling carbon dioxide. It can be great for working on respiratory swallow coordination, and it can be great for reducing overall anxiety and pain. So again, the goal is to breathe in very steadily so that we stay on this path. But if I have very shallow breathing, maybe just kind of that blast of air in and out without having good control, it may look like this. Right, so we're not able to stay on the path and we're not getting as much of the stars. And that will provide an actual percentage of conformity for how well we stayed on the path. We see that in the upper right-hand corner. We also see it here and in our outcome measures. So here's that percentage. I started really well. I was at 100% for a while, and then I purposefully showed you what it may look like if the patient gets off the path. So we're at 82% accuracy. Something that is unique about this particular exercise is that it's an adaptive pathway. So if the patient does score at a 90% or above, actually increases the challenge for how much duration is required, versus if they don't even get to a 60% accuracy, it will decrease that challenge for the patient. And just to show you the loops very briefly, here we can see both the inhalation and exhalation, so it's on the positive and negative side of the graph. Breath 1, 2, and 3 look very good, very symmetrical, low to the x-axis, versus at 4 and 5, where it's just, again, that shallow, quick breath of air.
For the next few minutes, I'm going to be sharing with you about ACP's Synchrony Dysphagia Solution System. This system is comprised of our OmniSEMG, or surface electromyography biofeedback technology, as well as our OmniStim FX2 portable pens, or patterned electrical neuromuscular stimulation unit. I'm mainly going to be focusing on our SEMG virtual reality biofeedback system during our demo today. But to mention our pens, this is part of the Synchrony Dysphagia Solutions program. And this uses a gentle therapeutic electrical stimulation waveform to help retrain nerves and support swallowing and speech function. When we speak to our OmniSEMG, or surface electromyography biofeedback, as you can see pictured here, this uses computer software and electrodes. And as you will see with the electrodes, this is placed on the anterior neck or the face for the patient to pick up the muscles of interest involved in chewing and swallowing. As the patient is performing different oral and swallowing interventions, the sensor that the patient is wearing is going to pick up this information and display it onto the screen, either in a simplified graph display such as our bar graph here, or in a virtual reality animated display as we see with our diver and kangaroo. And as we've been talking about research here, we know that there are decades and decades of research showing positive outcomes with the use of biofeedback in swallowing rehabilitation, helping patients to achieve their goals much quicker, return to better quality of life with least restrictive diets, moving from PEG tubes to being able to eat again, and achieving those outcomes quicker. In addition, we see that patients do attend to therapy and participate with greater intensity and also with better participation than they would if they did not have biofeedback, helping them to understand and engage what they are doing in therapy, especially when it comes to the muscle groups involved in swallowing and chewing. It is something that's very hard for us to see or palpate when we are in the clinic or at bedside, and having additional information here to have an idea of how the muscles are moving can help us to speak to the patient about gaining better volitional control over their muscle movements, as well as learning certain movements maybe as a swallow exercise. As you'll see here, we do provide education and training that is ASHA approved that accompanies the Synchrony Dysphagia Solutions system. And this may be something that's offered remotely or on site for your clinicians. We also have this ongoing for our on-demand ASHA approved courses. So not only would you be able to get the initial training for Synchrony, but you are also able to subscribe and be able to have ongoing dysphagia CEs for your clinicians. And these would mainly be revolved around dysphagia rehabilitation. Again, some of these benefits with looking at Synchrony is that we include treatment pathways and protocols. We have an assessment to have baseline data for our patients, more objective outcomes, which can help with our clinicians' documentation, as well as the fact that we do have, again, this virtual reality biofeedback that's very engaging for the patients when many times they may not understand the point of swallowing therapy. This helps them to really buy in and show up for therapy. It also helps your clinicians to now understand, is the patient accurately completing this exercise, and how do I systematically progress them with challenges? Over the next few minutes, I am going to share a demonstration of our Synchrony Dysphagia Omni SCMG VR biofeedback technology with you. As you can see, I'm set up with the required materials here, which consist of an electrode, lead wires, and a sensor. I'm not connected to the actual computer. I am wireless from the computer. And again, we could use a laptop system or a full-size clinical unit. The patient can be several feet away from the unit and it still picks up and works for that patient. What will happen is as I'm moving my muscles, it's going to pick up via this electrode. There's no electricity emitted into the muscles. It simply picks up that muscle activity and through the sensor displays it onto the computer screen in either a graphical representation or a virtual reality animation. Again, this can be very helpful when we are working on swallowing or oral exercises, in addition to learning to gain volitional control over muscle movements. I'm going to show you just a couple of examples of what that would look like. So I'll share the Synchrony software with you now. And I'm going to go under our demonstration mode for today, but the clinician does have the opportunity to input patient data here. So for any new patient on therapy, they can start a new treatment. And then as they're working with the patients, they could simply continue treatment and select the patient from this list. This is very nice to allow the patient to go back day after day and revisit the session history, see what that patient was able to complete that day. This helps them to more systematically challenge the progression for that patient as they're working from session to session. This could be with starting a new exercise. It could be with providing another bolus. It could be with maybe increasing their repetitions or their sets of repetitions. There are multiple parameters that are able to be edited as well during this. They can use this for more objective documentation as well for their goal setting and daily and weekly note writing. But again, I'm going to stick with our demonstration mode today. And we're going to go to our exercise of typical swallow. I'm going to use a bow and arrow where the goal would be almost like a carnival game, where there's a bow and arrow at the bottom of the screen and there are balloons that come across the top of the screen in the sky. And the goal is for the patient to swallow quickly enough that the arrow is released and pops that first balloon that comes across. And again, if our patient has a few second delay, like I just tried it, over 5 second delay, we could edit some of these parameters to maybe make it something less than 5 seconds, but you could change that. Maybe you start with 4 seconds and go down to 3, so on and so forth. You also can change the rest period in between the swallow repetitions. So we are able to edit all of those parameters. So again, I'm just going to put in some information here. And every exercise starts with a pre-exercise, very similar to what we just saw in assessment. We're going to get a resting baseline first, and then we're going to get 3 normal swallows to calibrate the system for where those peak amplitudes are. So we'll try that now. Okay, great. So that was my resting baseline. And now I'm just going to mark repetitions for my swallows. Okay, so then the system is going to stop for me and I could move if I was maybe not on this peak. If I missed it, I can certainly move my arrows, but I was on at this time. I could also uncheck if I was not happy with a specific repetition and just use the 2 that I like or go back in and resume pre-exercise to get a 3rd. So now I'm going to move over to our virtual reality animation for our swallow exercise. And again, this would be more for a swallow delay or timing issue. And it may take just a moment for Zoom to switch over to the animated. So bear with me for a moment. I'll let this first one come by just so we can talk about the next one. So my goal is to swallow at the exact time that orange balloon is overhead. Okay, and because I got it, we do have this auditory and this visual feedback. Hopefully you can hear it, but there's the balloon's been hit, the confetti comes out, and you actually get a reward. You hear the people clapping in the background, right? So we'll try to do that again. We want to get this on time for the orange balloon. Right, and the goal really would be to time it just right, where you give your patient the bolus just before, they take their bolus just before they get to that set of balloons. So that would be if they swallowed timely. If they missed and maybe got one of the later balloons, it could look like this. So not as much feedback in that case, right? So obviously we were just a little bit delayed. Let's see if we can, maybe if we were a little bit too early, what that would look like. Okay. Again, you get the idea that the patient's able to use this as a visual target. For those patients who do have swallowing delays, it's very difficult to understand what that is and how to speed up that swallow initiation. Being able to see it in a visual representation can be very helpful. So I'm going to end the exercise. And you can see here, out of my 4 repetitions, 2 were on target, 1 was late, and 1 was early. So you do get this information. And then you can continue, and I'm just going to share my screen again to show you what our results would look like. And so you would get some different outcomes here. So you could find out how many repetitions the patient completed. We could go in and view those repetitions, and we could move the event marker if we needed to, if maybe we weren't on the peak of the swallow, if we missed it. So no problem if we missed it during the live exercise. We could also come in here to the graph and see, was that patient swallowing timely? So we would want them to be swallowing inside of the screen. We can see for the first 2 repetitions, we did that. For the third one, it was a little bit delayed. And for that 4th, it was just a little bit early. And again, if I were to be under a patient name, I could save all of this information and come back and look at this later, or even be able to print that information. I'm now going to walk us through an effortful swallow. And as we can see over here, we can still put our bolus information in just like we did with our typical swallow. And we're also able to change our visualizations. So I'm going to show you another virtual reality animation of our kangaroo exercise. And we're also able to edit parameters here if we need to do that. For our effortful swallow, this is great because it's a really beneficial exercise that many of our clinicians use for our patients because it helps with so many areas of the oral and pharyngeal phase of swallowing. And as we're going to be looking at this together today, this is going to be based off of a dynamic target. So very similar to what we just saw with typical swallow, in our pre-exercise baseline, we are going to get 3 typical swallows so that the system can average out the average amplitude of the peak of those swallows and then set a threshold of more effort, so a target level above that average. And we're going to start at 125%. Effort above the average of 100% where the typical swallow would be. We're going to start there, and then we're going to have the patient to employ an effortful swallow. If the patient's able to meet this target level 3 times in a row, it will automatically increase the challenge in increments of 10%. So in this case, it would go from 125% to 135%. Vice versa, if this is too challenging for our patient, it's going to take it down if they miss 3 swallows in a row. So it would take it from 125% to 115%, so on and so forth in increments of 10% until it finds the right level. It's going to cap out at 150% effort. As we see in the research that most healthy normal individuals swallow to about 150% effort during an effortful swallow. So I'm going to show you this now. We'll get our pre-exercise first. Okay, now I'm going to get 3 typical swallows and mark those repetitions. All right, and again, I'm able to adjust the parameters if I were not to be on the peak, but I am, or I could uncheck if I wanted to get another repetition. Okay, now that we're here with the kangaroo, the goal is for the patient to swallow hard enough that the kangaroo jumps and gets the coin. As the clinician, I can also look at my sensor data here to make sure that the patient gets over this top line of 125% effort during the swallow. And it's going to keep account of my repetitions up here. So we'll try that now, and I'll still continue to mark a repetition. And again, this coin level is at that 125% effort from my typical swallow average. And if we can get one more, it should move up to the challenge level of 135% effort. We see that it does very quickly here. And we'll see with the next coin, it looks like it's a little bit higher in the sky, kind of zooms out. And we were able to get that one. So I'll go ahead and end the exercise. You do get a coin count. The coins obviously meaning how many times the patient did get to that effortful swallow level. But I'll bring up very quickly and show you here. Let me share my screen to show you the outcome measures. And we can see green is good. If I were to have missed the target level, it would be red and it would be below the level. And we can even see where it does jump up from that 125 to that 135%. It does give me automatically the amount of repetitions that were trialed and how many were on target. This time one and the same, 4 out of 4. It will tell me what the average microvoltage peak was during this exercise, how long the exercise took. Again, I can go through my repetition graphs and I can move anything if I need to. And I can also look at the parameters to see what that level was where I started. So 125% effort. All of this can be very helpful for the clinician's objective documentation.